If we continue looking at those value systems from neoliberal capitalism, the second thing about it is that the role of the state is defined quite clearly as one that is there to create and to sustain a competitive market environment, and that allows citizens, consumers, maximum access at minimum price to whatever consumer goods they want to purchase. So you can see that this is not particularly a set of values that is going to live or sit easily with public health values. Public health values are so totally different. They advocate health, and in a more general way, the public good, because you're not solely talking about physical or mental illness, debility, or premature death. You're talking about social issues too. You're talking about peaceful neighbourhoods, peaceful families. You're talking about not having neighbourhoods which are characterised by a high level of public order offences, or lots of families characterised by alcohol-related domestic violence, or families where family dysfunction is totally aggravated by heavy drinking, where the welfare of children is seriously compromised. Public health values reflect a belief that the ordinary citizens don't always make sensible consumption choices, and that the state has a right, it can legitimately interfere. The phrase health promotion people have used traditionally was to make the healthier choice the easier choice. Now, let's think this is something that only applies to alcohol. Of course, that is not the case at all. I'm going to refer to the great theorist John Stuart Mill, who, around the time that John Snow was taking the hand at the Broad Street pump, he was writing this famous book called On Liberty, which is still being reprinted, and it is still in many ways a sort of the libertarian gospel. It is the essential statement that the state ought to back off, and it is the essential statement that individuals know what they want to do. But then John Stuart Mill did not live in an age of marketing. John Stuart Mill did not live in an age of high technology advertising. And there is something naive about holding up this example, and it was very sexist about a man who would go to hell his own way. But that choices, the choices, the notion that individuals are basically rational, they basically know what they want. If we have a generation that has grown up seeing nothing but heavy alcohol consumption all around them, seeing marketed at every turn, so much so that when June sees the poster saying something slightly different, she's struck by it. And there are other examples of this. Probably the biggest one, and one that you will see developing, is in relation to food. We've already had this in the past few years in New York, where I've forgotten which mayor was it, Bloomberg, tried to change the size of soft drinks that are being sold. And that was because most of Western society, because of the food consumption choices that we make, is experiencing an epidemic of obesity, and related to that, a huge increase in the prevalence of type 2 diabetes. And you can say we should be working hard technically to try to develop better methods of managing or curing or preventing diabetes, but the most obvious thing is to go back to people's consumption habits. So you get a fairly similar debate going on in relation to food. But applying the public health values to the alcohol situation, what it really says is that the state can and the state should use regulatory strategies that will challenge the notion that alcohol is just an ordinary consumer item, and that the state is entitled to introduce strategies that will either reduce or stabilise consumption by making the product less available, less accessible, more expensive, and in a general cultural way, less normalised. So we have obviously clashing value systems here in Ireland as we have everywhere else. And the main clash is between the public health community and the drinks industry. The industry regards the public health point of view as paternalistic. It is nanny state, government telling you what you should do. And in turn, then, the public health people are a bit dubious about the bona fides of the drinks industry, and they don't really believe that the people who work in the drinks industry are got into this because they believe in some abstract way, in these values, and that people working in the drinks industry lull themselves to sleep at night skimming through the pages of John Stuart Mill. They know perfectly well that what motivates industry, all business, is the bottom line, which is profit. And that these kind of claims to be philosophically libertarian, that they're nonsensical. Partnerships. One of the great advantages, as far as I'm concerned, of the decline and recession in the last few years is that people don't talk quite as much about partnerships as they did before. We had 20 years in which, at central government level, social partnerships provided the basic framework. Some people thought that the Loftus, the oil and channel, had become irrelevant because everything was sorted out in partnership agreements. But in looking at how governments manage the alcohol issue, it is difficult for government. And typically, they will look for compromise. That is the nature of politics. So if you have two bitterly opposing factions, you have the drinks industry on one hand, and you've got the public health community on the other. The role of government a lot of the time is to try to see, can we not find a bit of common ground? Can we not work in partnership? The reality is that these partnerships don't really work at all because the conflict of interests are so stark. There is very little common ground. And what our experience here has been, it's the same in other countries. I think it's probably a bit more pointed here, that when drinks industry people are given a place at the policy table, particularly when it's at the public health policy table, that you don't get compromise, consensus, negotiation. You tend to get even greater polarisation. And the two groups, Fergus McCabe, I would like to quote on this, because he laughed about the National Substance Misuse Strategy, the document that we had in 2012. There were two drinks industry partners, our representatives on that, and Fergus described it as trench warfare. But there was no meeting of minds and hearts. And public health people, when they look at the proposals and the activities of drinks industry, those activities that are ostensibly aimed at preventing problems, they normally say, well, the drinks industry will always support strategies, will fund strategies and deliver strategies only on the basis that they're going for strategies which are ineffective. The only kind of alcohol problem prevention strategies that they're likely to fund are those ones that they know perfectly well don't work. The Scottish experience.